Hi, everybody. My name is Dr. Mary Claire Haver. I am a board-certified OB-GYN physician. I'm also the creator and founder of the Galveston Diet. I have 18 months in postdoctoral education in nutritional medicine and am a culinary medicine. I'm certified in culinary medicine. So I have married my passions for women's health, specifically menopause. I am a menopause specialist and nutrition into my program, the Galveston Diet. You can learn more about it at the link up in my bio at Dr. Mary Claire or at galvestondiet.com. But tonight, I want to come on live and have a conversation with you all about menopause, and I can answer some questions, but also about supplements that I often recommend to many of my patients and some followers in their menopause journey that might be helpful. So if you are just joining me, I'm going to ask you to do me a quick favor. Tap my face like this, like just take your finger and like bang on my face on your screen. That is going to generate likes. It's going to help keep me relevant on this platform. TikTok asks me every now and then to stop and do it. And it helps drive the algorithm and keeps me relevant on this platform. Okay, it looks like we're getting some masses joining. I'll introduce myself one more time. Hi, if you're just joining, my name is Dr. Mary Claire Haver. I am here in Texas. I am a board certified obstetrician gynecologist. I also have an additional 18 months in medical nutrition, and I am certified in culinary medicine. I've married my passion for nutrition and women's health, specifically menopause, and created my program, the Galveston Diet, which is a wellness program for women in midlife, in perimenopause and menopause. You can go check it out. However, tonight I want to come on and answer your questions about menopause and talk to you about my favorite menopause supplements that I recommend to my patients and why I recommend them, and to students in general. So, oh Lord, TikTok. Okay. So, thank you for the likes. We're up to 4,000. So to like this video, you can also share this video with the share button down here with someone you think it might be helpful for. You just click this right here. Also, if you don't follow me, I welcome you to follow me. I'm getting very close to 2 million followers. So it's also a little bit of a drum roll to see how quickly I can get to 2 million. So, when we talk about supplementation, so my education in nutrition has taught me that the majority of your nutrition should come from food, okay, not supplements. You cannot out-supplement a poor diet. Supplements are meant to supplement a good, healthy diet. So you cannot eat, make choices that are pro-inflammatory and not very nutritious, and then swallow a handful of pills and expect one to negate the other. They're supposed to work in tandem together. So the first thing I'm going to talk about that almost all of my patients, I end up recommending to almost everyone, is a fiber supplement. Now, there are several on the market. The Metamucil is one. I actually have one. It's called Galveston Fiber GDX from the Galveston Diet. Again, if you're already on a fiber supplement that you're happy with, drop it in the comments to share it with other people. I developed this one because I wanted to make sure that my fiber supplement had no added sugars and had a good mix of soluble and insoluble fiber. Both types of fiber have very important jobs and help keep us healthy in different ways. And so the average American woman only gets about half of the recommended daily fiber with her diet. And so so she's only getting about 12 grams per day in the typical Western diet. And so if you're not tracking, if you learn nothing else from this talk tonight, it is you should be tracking your nutrition. And my daughter is a nutrition science major. She's about to graduate this year, and then she's going to medical school. She was going to become a registered dietitian and then decided she wanted to go straight to med school and not do the extra 2 years to get her RD. But she still has all this gorgeous background training in nutrition, and she recommended Chronometer to me. So that's what they use in a lot of nutrition programs. Chronometer is a nutrition tracking app, and it will track your macro and your micronutrients. And really what I want you to focus on is micronutrients. So fiber is one thing that you absolutely should track. Do it for a week. Just do an experiment. Just eat what you normally eat. Download the free tracker and pay attention to a few micronutrients. And I have a whole TikTok about this. It's probably my most famous one. Fiber, magnesium, omega-3. Just track those 3, okay? And then vitamin D is the other one. And see if you can, utilizing food, get to the recommended minimum RDA, which is loaded in the tracker. It will show you, like on a little graph, how close you are to meeting your limits. And you might find that you are not getting enough fiber in your diet. If that is the case, the minimum for a woman is 25 grams per day. Okay, that is recommended by the World Health Organization and the American Diabetes Association, as well as the American Heart Association for women. I push to 35 grams per day because I have pretty rough family history of cancer. It really helps with my IBS. It's really, really powerful for me, and it brings my blood sugar down. It keeps my insulin in check because we have horrible diabetes in my family as well. So the tracker is on our website. You can find it at galvestondiet.com, or you can just Google it. It's Chronometer, Cronometer. So this fiber supplement has not only psyllium husk, which is the main ingredient in most fibers, and if that's what you're taking, you're happy with it, then keep going. I don't want to change your mind. But this one, I also added several mixed grains. I have buckwheat, millet, quinoa, amaranth, chia seed, apple fiber, citrus pectin. And then we also have a little bit of stevia and monk fruit to make it palatable. If you've ever done a fiber supplement without any kind of flavor in it, it is like tasting sawdust. So I supplement to get myself up to 35 grams per day. I easily get 25 in my diet. I'm an avocado a day girl. So if I can get that avocado in between my nuts and my seeds and my apples and like my fruit and veggies, I'm getting a solid 25. But I want to hit 35, so that's what I supplement this. And this will do a lot of things for your body. It does bulk up the stool, so you have a quicker passage of stool. You have the big water-bound, easy-to-pass stools, like so wonderful. I mean, if anybody's struggling with constipation, I highly recommend this. And then also, it feeds your gut microbiome. The soluble fiber feeds your gut microbiome. It is the prebiotic, okay? And when your gut is happy and well-fed, you are happy. The gut-brain connection, everything is about your gut. No, cowboy men, I'm not going to go live with you. So lowers your blood sugar. It also decreases the rate at which you absorb glucose into the bloodstream. That keeps your insulin levels low. Lower insulin levels, lower inflammation levels, lower visceral fat deposition, lower cortisol levels. It's all so healthy. So if you want to look at this stuff, it's at the link at the top of my page. At the TikTok page has, if you click up, there's a link in bio, it's bolded. You click on that and it will take you'll see the supplement link in there. So if you want to go check it out. So I would say you guys should be tracking what you eat. If you're falling short on fiber, no matter what you do, you may want to consider a fiber supplement. I make it. So yeah, I have a supplement company, and I just have a few. I don't do a whole bunch. I do take some that I don't make, and I'll show you those as well. So this is the first one, fiber, so good for you. You should be getting a minimum of 25 grams of fiber a day. So everybody, we're up to almost 1,000 viewers. Take a second, tap my face, everybody, fast, 10 times. That is gonna drive likes. The likes will drive the algorithm and will allow this video to be seen by more people. So the next thing that I recommend, and I'm lazy and I like to combine things, so I created an omega-3 and vitamin D. Oh, thank you so if you tap real fast a bunch of times, it'll make this heart by my face and it'll go across and then it'll give me this like stream of hearts. So thank you. And thank you for the gifts. Anyway, thank you so much. Yeah, we're up to almost 20,000 likes. So this is omega-3 and vitamin D combination. So about 80% of my patients are deficient in vitamin D. We can measure omega-3 levels, but it's not something we regularly do. The average American, omega-3, omega-6, and omega-9 are all essential fatty acids, and we usually have no trouble meeting our omega-6 and omega-9 levels that we need. The way that we store omega-6 and omega-3 in our cell membranes is pretty interesting. So they make up the cell walls, okay, because they're hydrophilic and hydrophobic. They're two the fatty acids have like a hydrophilic side and a hydrophobic side. And so basically they hook up like this. So omega-6 and omega-3, however much is in your bloodstream of omega-6 and omega-3 is like the ratio that's going to be in your cell membranes, and that's the storage facility. So when your body needs an omega for body processes, it will pull whatever's available. So if you have a lot of omega-6, that's what's going in. If you have a lot of omega-3, that's what's going in. So the breakdown, like metabolites of omega-6 tend to be more inflammatory than omega-3. Okay. And the typical American diet, again, has 20 times the amount of omega-6 than omega-3, where when we developed as a species, as humans, we were eating about 1-to-1, maybe 4-to-1 at worst. So, the goal is to try, and so we are eating way more omega-6s than we ever used to, which is leading to, we think, a pro-inflammatory state. Not that all omega-6s is bad, it's more about the ratio. And so taking omega-3 supplements can be helpful, and really trying, so what my nutrition professors were, look, you got to get one good source of omega-3 in your diet, whether it's salmon, fatty fish, flax, chia, whatever, okay? And then really try to not overdo the omega-6s. So that's things they put, it's like corn oil. So think of vegetable oils, which in and of themselves in small amounts are not bad. It's just we're eating so much of them. And they're baked into the baked goods. They're in the processed foods. So with all this processed foods, you get all these double whammies loaded with omega-6 oils, artificial colors, artificial flavors, preservatives, so we're just getting way too much of it. So omega-3 supplementation is found to be helpful with heart disease or diets rich in omega-3, heart disease, eye health. I had, a patient, this is just anecdotal, but, a few patients have come back and said that their eye doctors were like, oh my God, your eyes look so good. And I'm like, wow, no one ever tells me that. And you must be taking omega-3s. They're like, yes, I am. And I combined it because they're both oil-based. I combined the vitamin D with omega-3 because I am lazy and I like easy, and taking less things is better. So I can get these all together. Now, this is a maintenance dose of D. Okay. Now I get plenty of potassium in my diet. I don't need to take a K2 supplement. It's not necessary. Most people get plenty of potassium in their diet. So I don't, I have great absorption. This is maintenance dose. If my patients come back and they've not been on any D and they are deficient, I will put them on a prescription strength loading dose for about 12 weeks. They do a once a week 50,000 dose. This is 2,000 a day. So it's a pretty big difference. You cannot take that 50,000 every week ad nauseum because you could become toxic. Remember, fat soluble vitamins K, A, D, and E can all become toxic. Vitamin A causes severe toxicity. That's we see birth defects with that. Okay. So you can't just take D ad nauseum. You really should keep getting your levels checked, especially if you're on the super high levels. But this is a maintenance dose. If you stay below 4,000 a day, you won't get in any trouble. Most experts think that's okay, and this one has 2,000. So hang on, water. So we talked about fiber, we talked about omega-3 and D. Hi, Wendy. Good to see you. I'm glad you caught me live. All right, turmeric. This one's new. I just came out with this one. It took me a year to develop. So I have a blog on my website at galvestondiet.com. Keep the likes coming. Thank you. You guys, it drives the algorithm. And if you don't follow me, please follow me. Please. We are so close to 2 million. Oh my God. We are so close to 2 million followers. I still can't believe here's this mom, 2 kids, sitting in her kitchen in Galveston, Texas, talking to her phone, who has almost 2 million followers on TikTok. How did this happen? I don't know. My kids made me get on TikTok during the pandemic. They kind of shamed me into it. I gave it a whirl and it took off. So the turmeric, go read the blog, okay? When I do research, okay, I specifically look for articles related to menopause. So I was doing turmeric and menopause related articles, and I was like, holy crap, there is some awesome information coming out in the last 2 years. Turmeric is great for arthritic pain and musculoskeletal pain, joint pain associated with menopause. It is great for headaches. It is great for people think clear. Like when they took it for a year, their mental function was better. I'm like, holy shit. And their visceral fat was better. It lowers inflammation, therefore lowers that drive of fat to the abdomen. Yes, I have an MD. Oh, in case you don't know who I am, hi, I guess I should introduce myself. I am Dr. Mary Claire Haver, MD. I'm a medical doctor. I got my medical doctorate from LSU, Louisiana State University. I did my residency at the University of Texas Medical Branch, and I did my postgraduate training in medical nutrition at Tulane University. So I'm a menopause specialist, and I have just everything I do starts with nutrition first because of my background and my training. So turmeric check it out. So this is one that, the active ingredient in turmeric is curcumin. There's low bioavailability. This is never anything you want to inject IV. This will kill you, okay? But orally, we don't have great bioavailability. Oral, now I do combine it with piperine, which is the black pepper extract, to increase the absorption, increase the bioavailability. But it's hard to get toxic on this unless you go IV. Do not let anyone give it to you IV. They will kill you. That actually happened. But this has consistently, in some pretty beautiful studies, been shown to be helpful for menopause women. You can read all about it in my blog at the top of we're almost at 50,000 likes. Keep them coming, keep them coming. So I don't know of any risk of curcumin with other medications. Fiber, there's a couple of things you probably should not take with your fiber supplement, that they might get bound up in the fiber and not absorb very well. So any serious medication that you are blood pressure medicine or anything, I would just take those as directed and not do your fiber until later, okay? Like an hour apart. All right, so we've talked about turmeric. These are the ones I make, so of course I'm gonna talk about them first. And I do take all these. All right, and then I have collagen. So full disclosure, I don't make this collagen. It's made by a company called Sparkle. Okay, so back up before menopause. Here I am with my little girl. She's little at the time, in the dressing room trying on bathing suits or whatever. And I'm kind of upset at myself in the mirror because I was raised in the United States where we're taught to hate our bodies, and no matter what they look like. And I was hemming and hawing over the cellulite I had. Now, as thin as I've ever been, I've always had cellulite. Cellulite hanging off of bone is no more attractive than it is with some meat behind it. So here I am, kind of a thin, skinny person at that time, but I had cellulite. And so I'm and my daughter's like, Mommy, cellulite. She starts talking about my cellulite and poking at it and pointing at it. And so then I'm so about myself. I start looking up medical articles about cellulite and what can you do about it? What can be helpful? So I run across these articles, and you can look them up. They're actually on my website, about a specific type of collagen called Verisol, Verisol. And studies were done looking at wrinkle depth and cellulite depth. They did laser measurements. This was a beautifully placebo-controlled done study. And I was like, wow, it won't hurt me. I might as well try it. So I'm like, where do I find Verisol collagen? And I find this company called Sparkle. So I start ordering it. And then I started telling people I was using it on social media, and they would run out. And so finally the company's president found me and called me, and he's like, hey, you are making me run out of all of my supply. And I'm like, I'm sorry. And he goes, no, it's great. So long story short, we went into business with them. So I buy Sparkle from him. He's now our distributor too. Okay. He's a great guy. He's from Australia, but he has a warehouse in Dallas. So we made him our distribution center. So anything shipped from me comes from his distribution center. We put our label on their Sparkle product. So it's called co-branding. It's really a cool thing because everybody benefits, in the equation. So I mix this and this together. I mix the fiber and the Sparkle together in the afternoon. And I sip on it. It takes me 2 or 3 hours to get through it with a ton of water. I use a big 30-ounce water and keep diluting it, and that's my plan. So I take 3 other supplements I'm going to show you guys. One I take for sleep. So I saw some people, yes, I do mix them just because I'm lazy. Again, I like easy. When I talk this much, I get so thirsty. Okay, so the turmeric, they're squishy, so they're soft, but this is the size. So I'm going to put it up to me. Put it up to my finger now. Okay? So it's not small. It's not small. So if you struggle with swallowing pills, this may not be for you. Hey, Ponchatula. All right, and then the omegas are tiny, and you take, the dose is 4. So the omegas are little bitty guys. They're little. See? I'll put it next to my finger again. These are little. These are much easier to swallow, okay? If you have a shellfish allergy, our omegas are from not shellfish, but they are from sardines. So if you have a fish allergy, you're not going to want to do this. Now, Nordic Naturals, and if y'all know of another company, just drop it in the comments, makes an algae base. So the fish eat the algae, which is how they get the omega-3 in their body, right? They don't make it. They eat it through the algae. You can find the algae-based, which is no fish. So if you have allergies, that is going to be your source. I know Nordic Naturals makes it. It's more expensive because it's harder to make. But there is a... you do an omega-3 patch. Guys, you see, anything that's fat-based, like omega-3, that's a fat, okay? Vitamin D is a fat. Vitamin A is a fat. Transdermal fat does not go through the dermis. You need water-based. And so omega-3 patch is probably not going to work, okay? You don't do anything that's fat-based through the skin. It doesn't absorb. So be careful. I don't know I've never heard of an omega-3 patch. Bless you. I would do oral for that. Okay, that's just my 2 cents. I also take Magnesium L-threonate. Okay, this is the Life Extensions brand. I'll pause so you can screenshot this and then flip the picture around on your phone. I do this for sleep. Okay, so there's multiple forms of magnesium. I always get a million questions about this. There are people who are magnesium deficient, and probably half of us are not getting enough magnesium in our diet. Again, tracking. But I get plenty of magnesium in my diet. But I still take this. I don't take it to correct a deficiency. I take it for the medicinal benefits, okay? So it's also called Neuromag or Magnesium L-threonate. Again, take a picture, flip it when it's done, okay? I get it from Amazon. It's not the cheapest magnesium out there. But this formulation, the Magnesium L-threonate, is the one that crosses the blood-brain barrier the best. The best. So if you are trying to, magnesium L-threonate has been shown to be helpful with menopausal depression, with all-cause depression, with SSRI-resistant depression. This is helpful. It also helps relax things. It's great for sleep. I take it in the evening before I go to bed. It's great. My daughter was recommended it. She was grinding her jaw involuntarily with her ADD meds. This helped relax her jaw so she didn't have the jaw grinding. So there's a lot of indications for this one. Now, if you have a low blood level and are trying to correct a deficiency, you may choose to do a different type of magnesium, but this is the one I take. And when my patients come in complaining of sleep or depression and they're SSRI, not really wanting to try it, this is what I recommend, okay? It's about $35 a month for the 1 month supply. Okay? All right. Now, I read a book called, has anybody else read it? Called Lifespan, Why We Age and Why We Don't. It's phenomenal. It is the most sciencey book. I had to literally hang on by my teeth to figure out what the hell this man was saying because he's so freaking smart. And I'm not dumb. I'm medical. And meaning, I use that lingo. And so I would have to stop it or put the book down and think for a hot second and then go back and read the paragraph again. But I heard the audiobook is better. So it's Lifespan, Why We Age and Why We Don't. And he is really smart. So he convinced me to take these 2 supplements based on his research. And they're not really harmful. So one is nicotinamide mononucleotide or NNM. Okay. These are for longevity. These are not helping with this is not helping with anything else. This is hopefully going to keep the end of my telomeres or my DNA from unwinding so I don't age as fast. Okay. Lifespan, Why We Age and Why We Don't. By Dr. Oh my God, I'm having a total menopause moment. Help me. Who wrote it? Not Peter Attia. No. David Sinclair. Dr. David Sinclair. It took me a hot second. Okay, so NNM. He doesn't talk about what dose. He just talks about the research behind it. David Sinclair. Okay, so NNM, I am taking this for maybe so I can live longer. Resveratrol was another thing he recommended to maybe live longer. And turns out there's some great menopause research on this too. Now, the doses the women were given in the menopause studies where they had decreased arthritis pain, they had, I have a whole video on it, a whole TikTok on it. But this also has some longevity benefits as well. This is 1,500 milligrams a day. The studies, the ladies were doing 75 milligrams twice a day. I'm like, well, and I can't find a much lower dose than that. So you don't need to take very much. So I take one of these every other day. So magnesium absorption does not work through the skin. It doesn't work, but it works orally, dude. Are you going to argue with a physician? I read this shit all day long. Okay. And don't take it if you don't want it. I'm just making recommendations. Okay. Thank you for the follows. Oh my God, you guys. I am so close to 2 million. And thank you. Thank you for all y'all. This is all y'all. Okay. So who out there is in menopause? Who is perimenopausal, menopausal? And I've got some big news. I'm so excited. I can't believe this. Let me see. Yes, yes, yes. Checks, likes, whatever. Yeah, men can take the magnesium. Yes. The studies that I read are generally for women, but there's lots of indications for this for men. Okay. Yes, yes, yes. Okay. So y'all probably know that my nutrition book, The Galveston Diet, is already written. It's about to be published. It's coming out in January 10th. And I'm super excited about it. You can pre-order it at Amazon or wherever you want to buy books. But, and thank you if you do, because they want to get me on there's a shot. We have a shot. I don't know if it's going to happen at the New York Times bestseller list because our pre-order numbers are so good. So yay. But that's not what I'm talking about. The pre-order book numbers are so good that I floated that I want to write a menopause book. And it looks like that might happen. And so, and get them to publish it. So yes, there will be, you can order the audiobook, the Kindle version, the ebook, or the hardback. And so, here's what I want the menopause book to look like. And I want your feedback. I want to hear what you think. So, of course, I'm going to tell my story and why I became a menopause specialist and kind of what the state of the world is with women being disgusted, dismissed, gaslit, made to think they're crazy. And it's really, and talk about the systemic problem. It's not that all doctors are assholes. Most doctors OB-GYNs go into this because they like women and they want to do good things. But then we're not taught. Like, there's a systemic problem with how menopause is recognized, taught, the nuances, how to treat. It sucks. We're not doing a great job. We have so far to go. Okay, so what do we do in the meantime? I want to write a book that will teach you how to advocate for yourself. And it's going to go system by system. We're going to start with the brain, and we're going to talk about what happens with the brain with menopause. Everything from brain fog, depression, anxiety, ADHD, okay? And then we're going to talk about the menopause toolkit for those symptoms. All right, here's what we know HRT might do to help or to harm. Here's what we know for depression, what other medications, SSRIs, how do you treat depression with, here, so you can go into your doctor. Here are some supplements that have been shown to be helpful, for women in menopause with this condition. Here is exercise, like these women who did this kind of exercise saw improvement or didn't see improvement or whatever. So you basically have a top-down, system by system, because everybody's menopause journey is different. It's not just hot flashes and night sweats, okay? A lot of us have those. I had them horribly, but I had horrible joint pain, horrible, my hips, horrible. And I didn't, until I read it on my own, no one taught me or told me that what you're happening in your hips is not that you're lazy or you're not stretching right. I mean, stretching can help, but this is menopause. It was a 2-year, what the hell is happening to me? So that is where I want it to be the menopause toolkit, and you go system by system. You just, what is this back pain I'm having? Back pain. Okay. Joint pain, headaches, whatever. And so I'm going to break it down and all evidence-based with all the studies of here's where we are and what you can do. And here's how to talk to your doctor about what you need. Okay. As well as this is HRT, what it's available, what the studies show, what kind of forms there are. Do you need this, that, the other? Why would you do a pellet over a patch, over a ring? And no. So that when you go in, you are locked, loaded, and ready to get your shit done with your doctor. So you go in, you're calling the shots. Here's what I want, here's what I need, here's the blood work I need. Thank you very much. Okay, that's my goal. You think I should do it? Okay, like this 1,000 times, as many possible times as you can if you think I should do it. Okay, so do you want me to show you the supplements again? The book is not coming. Okay, I have appointments available. But that I don't, because I don't see patients virtually. You must be in Texas or Colorado. I'm only licensed to practice in those 2 states. But if you want to come and see me, if you go up here to Dr. Mary Claire and you go to the top of my page, hang on, I need to grab my laptop because I'm going to look up something for y'all. I'm walking around my house. Hello. There's my doggy. Say hi. Hi, Bubs. He's like, all right, do you want me to show you? So we were talking about supplements earlier. So you can come and see me in Texas. I'm outside of Houston. I have a packed clinic every day I'm open, and I love it. I love helping people. I love that I can do this for patients. And I give them the menopause toolkit. We talk about their symptoms, and I come up with a specific nutritional exercise supplement, HRT or no HRT, whatever we decide, plan for them to live their best life. So they're not coming in to rock a bikini. I mean, that would be great and all, but they're coming in because they're like, listen, I am looking at my mama, and I don't want that. I don't want to burden my children with my suffering. I looking at my family history and know what can I do to avoid that, okay? Very few women come to me because everybody wants to lose weight. That's normal, okay? That's fine. But literally they're coming in because they're scared of the future. They're scared. Oh, I know Dr. Pat. Yeah, Pat Thayer. She's great. I know her. I do. She was great. I worked like in the same hospital with her for a few years. Okay, I'll show you the supplements again. Okay, fiber. Okay, now I make some of these supplements, but you don't have to buy mine. I'm just telling you about this. I would appreciate it if you bought mine. It's paying my bills. But fiber. So the fiber is, if you go to galvestondiet.com, everything's there. If you go to shop.galvestondiet.com or just go to Dr. Mary Claire, we're almost at 100,000 likes. Go up there, click on that, and there's a link at the top that will take you to, it would be like what to expect when you're expecting, except I would be sued out of my mind if I used that link. So the fiber is recommended because women only get 50% of the fiber that they need in their diet. And women who have diets rich in fiber, like over 25 grams per day, have been shown to have less visceral fat, lower blood sugars, lower insulin levels, better gut health. And it is absolutely, menopausal women do way, 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 way better overall in all aspects of their health, including visceral fat deposition, than women who do not get enough fiber in their diet. If you don't know how much you're getting, I recommend that you track your fiber intake. How do you do that? My favorite tracker is Chronometer. Chronometer is my fave. Okay, so this is our fiber. This is our collagen. So collagen, great for cellulite, great for wrinkles. That's why I started it, completely for vanity reasons. But it turns out it's great for osteoporosis prevention. So if you got a mama with a humpback or fell and broke her hip, you want to think about something like this, okay? This particular, how do you get so much fiber? I eat chia seeds. I eat flax. I eat seeds. I eat nuts. I eat apples. I eat vegetables. I eat fruit. I eat an avocado a day. That's how I get my fiber goals. I also supplement with my fiber so I can hit 35 grams a day. This collagen is not fish-based. So it also has vitamin C and hyaluronic acid. This has a lemonade flavor. So if you don't like lemonade, this one isn't for you. I mix these two in the afternoon because I'm lazy and I like easy. You can dump it in a smoothie. And thanks for the follows. Thanks for everything, guys. Do I ever rest? Social media is a full-time job for me. Did y'all see my video where I was in my pajamas and they put it on national media? Thank you, Mary Claire. I was talking on YouTube. I got so excited. I do this all the time. I do videos in my pajamas all the time. And the national news media liked what I was saying about HRT, and they picked it up and put it in an article and put the link to the YouTube thing. And I'm literally in my pajamas with Peter Attia and Andrew Huberman on the same. They were quoted as well. And so it's like my big moment to be in something because I respect them both and I really enjoy their podcast. And I was like, oh my God, and I'm in my pajamas. Yay me. Okay, also omega-3 and vitamin D. Something that most women are deficient in is vitamin D. 80% of my patients are deficient in vitamin D. Oh my God, you guys, thank you so much for the likes. This also has the omega-3 in it together. Again, I'm lazy. I made this so I could just have to take one thing instead of two. Turmeric, guys, if you're not a believer, I would look at I have links to all the medical journals. You can find the blog at galvestondiet.com if you just click on pause blog. This one does have the black pepper extract added into it, but there's some great data showing some tremendous benefits for turmeric for menopausal women. So let me find it. I'll read them out to you. Why are you losing your hair? Okay, we can talk about that in a minute. Okay, where'd it go? Turmeric and menopause relief. Okay, so what can turmeric do for you if you are a woman in menopause? Turmeric and menopause relief. Okay, So what can turmeric do for you if you are a woman in menopause? Remember that curcumin is the active ingredient. It is a polyphenol, which are chemicals in plant-based foods that act as antioxidants and provide health results. All right, so curcumin has been shown to have an anti-obesity effect. It also decreases visceral fat deposition. It decreases inflammation by decreasing oxidative stress. And it also, women who took curcumin had lower hot flashes. So those of you who are not able to take hormone replacement therapy or electing not to take it, you can try curcumin, turmeric for hot flash relief. One of the biggest things that really shocked me was that it helps relieve symptoms of osteoarthritis. So menopause, we see much worsening of arthritic pain, and this was shown to be helpful. When combined with exercise, women had better cardiovascular health monitors, including increased blood flow, and then it improved the gut microbiome health. This helps keep your gut happy, along with the fiber, guys. All of the articles where I pulled this information from are linked to this blog if you want to go check it out. And then, so those are the ones I make, and then these are extra ones that I take. I also take resveratrol. The studies in menopause that showed benefit were done with 75 milligrams twice a day. This is more than that. I have a hard time finding the lower dose. And then Neuromag, guys, if you have depression, if you have trouble sleeping, if you have anxiety, if you have any kind of mental health disorder, you should consider giving this a try. Along with whatever you're doing. Okay, I'm not saying it's first-line therapy, but there are multiple studies showing that this is helpful in SSRI-resistant depression, in helping with sleep disorders, but it's this particular, I'm going to hold this, you can screenshot it. Magnesium L-threonate, okay? Neuromag is the brand name, okay? I get mine from Life Extensions. You can get yours wherever, but you want this L-threonate. It's a little more expensive than the other mags, but this is the one that crosses the blood-brain barrier, okay? Crosses the blood-brain barrier. Thank you for all the likes. We're over 100,000. This is so awesome. And thank you for the follows, you guys. This means everything to me. So to like me, you just bat my face 10 times. So everybody take a second to do that. So if you're just joining, hi. I'll show all the supplements again. I'm Dr. Mary Claire Haber. I am a board-certified obstetrician. I am also a medical doctor. Somebody was like, are you an MD? Yes. I'm a menopause specialist. I also have an additional 18 months in medical nutrition studies from Tulane University, and I became certified in culinary medicine in 2019. I've married my passions in women's health and nutrition into my wellness and weight loss program called the Galveston Diet. If you want to learn more about that, we have a 20% off sale. I'm going to just shamelessly plug myself. The Galveston Diet, all of our programs, we have 3 programs are on sale for 20% off. And so you can learn about them if you go up to my link up here, or just go to galvestondiet.com, or go up to my link here at the top of my TikTok page. There is a link. Hit that blog, and the code is, somebody write it out, Menopause 20, MENOPAUSE 20, all one word, all caps. And that will save you 20% off of the program if you're looking for some way to help you get healthy. So, okay. Let's see. All right. I'm going to start answering some questions. So drop them in the comments. What kind of questions do you have? Give me a second to swipe over. Your doctor told me to check you out. Oh my God. Who? Thank you. I love it when another doctor, she says you are the way to go. Oh my God. Thank you. That is so sweet. Thank you. Thank you. Thank you. And thank you guys for the likes, the shares, the follows. This helps keep me relevant on this platform. It's really hard as a 54-year-old mom who speaks truth and tries to stay away from sensationalism. All right, let's see. I can swipe. Here we go. All right, let me see if I can get to your questions. How many grams of fiber a day? Okay, so the majority of your fiber, of any of your nutrition, should come from food. We only use fiber to supplement the gaps. And so get 25 routinely in my diet every day minimum. I supplement to try to hit 35. I push to high, the other limit of high normal, so that I can get the maximum benefits. Now, again, if you've never done a fiber supplement, you should start slow. You want to start with like a teaspoon of this and a lot of water, like 30 ounces, and then slowly increase the dose to the full scoop. And one scoop gives you 8 grams of fiber here. Okay, so this is just a helper. This should not be the main source. You can find my supplements at the Galveston Diet Supplements. So the fiber, the omega-3, the turmeric, and the omega-3 vitamin D combo, and the turmeric and the collagen. So these are the only 4 I sell at galvestondiet.com, or there's also a link at the link in bio at the top of my page. So now, the supplements aren't on sale right now, but the nutrition program is, if you want to go check that out. Okay. Can I discuss? Oh, the book for the nutritional plan is being released January 10th. I'm in negotiation right now to sign a contract for the menopause book, but hopefully I can get that out within a year. My skin looks amazing. Thank you. I will drop my skincare routine at some point, but basically it's what everybody else does. Vitamin C, sunscreen, a little bit of Botox here and there. And I work in an aesthetics, like my clinic is in this big center where they have an aesthetic center. And so I have access to some pretty good skincare stuff. Like I do the Morpheus 8. That's expensive and it hurts, but I only do that like once a year. Let's see, peri to menopause in 6 years. Is that normal? Yeah, that can be absolutely within normal limits. Remember, you're never too young for menopause. A woman at any age, though it's rare, but it can happen. So if you come in complaining of, as this has happened to anyone, you come in complaining of menopausal symptoms and your doctor immediately says you're too young and blows you off. It says, no, it's impossible, without even talking to you, getting more information, or running a possible blood test. Has this happened to you? I want to see. Let me see in the comments, because I'm sick of the gaslighting. And part of it is not that doctors are assholes. It is that we are undertrained, grossly undertrained in the area of menopause. Most docs, after the WHI study, the lectures on menopause hormone therapy dwindle down to almost none. Most doctors don't feel comfortable prescribing it. It's just not in their jam. And we have a lot to learn in residency. We have to learn how to deliver babies and take care of pediatrics and cancer and getting people pregnant and all those things. So all of that stuff is important, but it's like menopause and menopause care, and especially perimenopause, has been shoved to the very periphery of the OB-GYN education, and you guys are suffering because of it. So that's why I want to write a book, so you can advocate for yourself, you can educate yourself, and this will be a reference guide for you to be able to take to your physician with the latest studies and be like, look, this is what I want and this is why. Because you could actually teach your doctor something. So you started your HRT cream today. Good for you. That's awesome. Let's see. Itchy skin and eczema. Definitely we see eczema is an autoimmune condition. We see worsening autoimmune disease, but overall dry skin, dry eyes, dry mouth, dry ears. The loss of sebum production is dramatic. Hair changes, hair breakage, hair loss, male pattern baldness, growing hair in places that we don't want. Those are all symptoms. Thank you for the follows, guys. Thank you for the follows. Let's see. What is HRT? Great question. Hormone replacement therapy. So if you don't know what that is, that's okay. It's a term we use when you get up to our age. Let's see. Okay. All right. Do you want me to? Now, who's new here? So if you're just joining me, I am Dr. Mary Claire Haver. I'm a board-certified obstetrician gynecologist. I'm also certified in culinary medicine with 18-month postgraduate training in medical nutrition. I have married my passions into my program, The Galveston Diet. You can go check that out at our website at galvestondiet.com. We have a 20% off sale right now. Menopause 20 is the code you can use to save 20%. But I was talking today about our supplements and why I recommend them. I do not, okay, so if you want to, I practice medicine outside of Houston, Texas. You can check out my website. Again, the link is up here at Dr. Mary Claire. God, we're at 131,000 followers. Let's get to 200,000. So everybody take a break and tap my face as many times as you can. Follow me, share this video. You can hit the share button here with someone you think will be helpful. I'm going to go, so many of you are new here. I'm going to go through the supplements that I recommend routinely. and why I recommend them. So hang tight. Just keep liking this video by tapping my face as many times as you can stand. And that will help drive the algorithm and keep me relevant on this platform so that TikTok will keep showing this video to as many people as possible. So you like me by just hitting me in the face like this. Okay, so my number one thing that I recommend is fiber. About like this. So my number one thing that I recommend is fiber. About half of you are not getting enough fiber in your diet as you should. The way to know how much fiber you're getting is just for a week. Do an experiment and track your nutrition. Download a free nutrition tracker, like my favorite is Chronometer. Other people use MyFitnessPal or if you use the nutrition tracker, let me know in the comments which one you use. It really helps. Hormone replacement therapy does not cause cancer. So actually your all-cause mortality from cancer is lower. Okay, so fiber helps tremendously with bloating if taken correctly. Okay, you definitely can overdo this and it can make your bloating worse on the short term. But if you start slow with like a teaspoon and then work your way up over a few weeks to the full scoop, this would be a God saver for you. So it helps with IBS. It helps with, if you use it correctly, it helps with constipation. It also helps women who have adequate amounts of fiber in their diet have lower visceral fat, have lower accumulation of new-onset belly fat, have healthier gut microbiome. This is what feeds your gut microbiome. They also have more rapid transit of stool through the colon, which helps with detox, and this lowers your insulin levels. It lowers the absorption of blood glucose, and it is the food for your gut microbiome. It keeps them happy and healthy. Mine is made up of soluble and insoluble fiber. Soluble fiber is what the gut microbiome ferments, and it creates oxybutirates, which are healthy chemicals that get absorbed through the gut mucosa into the bloodstream and help keep your vasculature healthy. So there's so many good things about fiber. Now, if you're getting 25 to 35 grams of fiber in your diet without a supplement, you're fine, you're good, but you need to track to find out. If you're struggling, you may want to consider a supplement, and I do have one for sale. It is available at galvestondiet.com. If you go to supplements, it is one of the big supplements there. So Metamucil is psyllium husk, okay? It works fine, but it doesn't have the combination. So that's why I made this one. So Metamucil is psyllium husk, okay? It works fine, but it doesn't have the combination. So that's why I made this one. This also has monk fruit and stevia and no added sugars. Be careful if you do a different fiber supplement, which I support if you're happy with your fiber supplement, but read the ingredients. A lot of them are loaded with added sugars, which you don't want. Okay. So then I also I have a collagen supplement that I use. I originally started using it for my skin for the appearance of cellulite and wrinkles. However, it also in the last couple of years has been found that women who supplemented with this type of collagen had improvement in osteoporosis. So I use it to help keep my bones strong. So when I mix these two together every afternoon for a little treat, they're kind of orangey lemonade flavor, and I sip it all afternoon. I've got my fiber and my collagen, and I take them together. All right. And so both of these are available on my website if you want to check them out. I do also take a probiotic supplement. I just ran out and they were on back order. It's from Garden of Life. It is the Women's 85 Billion Raw. That's what I take on the days that I don't have yogurt. I pretty much don't eat probiotics in my food regularly. It's not a taste I grew up with. I don't love sauerkraut. I tried the fermented pickles. They weren't my jam. But some people love that stuff. And if you eat fermented stuff, kombucha every day, you're good. You don't need a probiotic supplement. You're doing it. Okay. You're living the dream. A lot of Asian cultures have a lot of fermented foods. They do fine. When we traveled in Japan, I was like, oh, these people don't need probiotics. They eat this stuff all the time, but I don't. So I supplement for that. And so I use, again, Garden of Life, 85 Billion Raw. And I just love it. So this is turmeric, and this is from Galveston Diet as well. This is our newest supplement. I have a whole blog about all the benefits of turmeric and what it can do for you, as well as the medical journal articles that I pulled for this. But remember, everything I research is for women in menopause, so you can check that out. And let me see. Oh, sorry, my phone dropped. Let's see. Oh, Lifespan is free on Audible. Good for you. That's awesome. Okay. Great. Yay. Okay, I'm looking at, okay. So, and then I also do an omega-3 and vitamin D combination. Again, lazy, like to combine things. I created this one so that I didn't have to take 2 pills. It has my daily vitamin D as well as my, omega-3 fatty acid. The magnesium I take is magnesium L-threonate. I do not sell this one. This is from Life Extension. This is specifically the one that crosses the blood-brain barrier the best. I get this off of Amazon. And you can screenshot this and then flip it around. I take it for sleep. It's also recommended for depression, anxiety. It gets into the brain. So any mental health disorder, it can be helpful with. It also can be helpful for... my daughter was grinding her teeth because of her ADHD meds, so it helped relax her jaw. Let's see. Okay, so let's see. Please show it again. Okay, y'all can screenshot it. Go ahead and screenshot this. Y'all got it? Okay. And then flip it on your camera when you get it back so you can read it. Okay, somebody asked about belly fat. Y'all just know me so well. I love talking about this. Okay, belly fat. Belly fat is, if you don't change what you do in perimenopause, you are more than likely, probably 90-something% of you, going to see an increase in belly fat where you never had it before. Okay, it's an increase in visceral fat. It's a different fat than subcutaneous. It is driven to deposition by different mechanisms than overeating, okay? It is not due to excessive calories. It is more due to increasing inflammation, increasing insulin levels, and cortisol. And it is linked to 7 of the top 10 causes of death, an increasing amount of visceral fat. Now, I have a machine in my office that I measure visceral fat in patients, and I can have really frank, honest discussions with them about their health risks. You can do a virtual measurement of visceral fat by your waist-hip ratio. You take a tape measure and you measure around the thinnest part of your waist, somewhere around the belly button, and then you divide that by the widest part of your hips around your butt, okay? And as a woman, your ratio should be 0.86 or less to be low risk for having abnormal levels of, or 0.7, you're golden. Greater than 0.86, more than likely you have an amount of visceral fat that is not considered to be healthy. And so now you want to do this in the morning when you're not bloated, after you've gone to the bathroom, you know, all the ways, okay? And so you don't want to do it tonight. You'll be unhappy. Just wait till the morning when your belly's its flattest and do it then. And then it's a much better indicator of your health than your weight or your BMI, okay? It's a much better, easier. So it is the smallest part of your waist divided by the widest part of your hips, and 0.86 for women is kind of the cutoff. Less than 0.7, you are good to go. No worries, okay? 0.7 to 0.86, meh, something's happening. Greater than 0.86, we got to talk, okay? And so, all right, so you take the smallest part of your waist divided by the widest part of your hips. The waist-hip ratio, you can Google it, waist-hip ratio, okay, as a health indicator. It's pretty amazing. So what can you do? Visceral fat doesn't respond that well. I mean, it will, but it's not, if you're starving, yeah, your visceral fat will go down, but that's not how you want to lose weight. Your visceral fat is going to respond to things not related to calories way better. It's going to respond to fiber, okay? Women who had greater than 25 grams of fiber in their diet per day had less visceral fat accumulation than women who did not, okay? Number 2, watching added sugars. People who have 25 grams or more of added sugar in their diet are much more likely to have abnormal accumulations of visceral fat associated with heart disease, okay? Added sugars are the sugars added in cooking and processing, not fruits and vegetables. Number 3, probiotics. Women who had diets rich or took a probiotic supplement have been found to have less visceral fat than women who did not, okay, in menopause. Number 4, like I said before, turmeric has been shown. Women who had supplementation with turmeric were shown to have less visceral fat accumulation than women who did not. So, all right. All right, guys. So those are my top tips. This is all on a blog on my website. You can go and check it out. Also, remember that... Okay, let me do a couple more questions and I'm going to jump off. Thank you for the likes, for the follows. My favorite probiotic is Garden of Life. Somebody type it out. Women's Raw, 85 billion. Garden of Life, Women's Raw, 85 billion. So, you're so welcome. I have so much fun talking to you guys. And I will save this video. And we have 293 new followers. Thank you so much. We are so close to 2 million. It's so incredible. We're at 165. All right, everybody tap my face as many times as you can stand. And that will give me a bunch of likes and help drive the algorithm to keep me relevant on this platform. But I'm getting tired. It's 8 o'clock. It's actually close to my bedtime. And I will always be coming on live. So please follow me. If you don't, I invite you to follow me. That will help me, again, stay relevant on this platform, and you won't miss any of my lives. And we will chat again soon.